Hi ladies, I wanted to take some time today to just explain really quickly one of the modalities that we use in the office to help women be proactive. And that modality is thermography. So let's go ahead and discuss what it is and how it can help you. I'm Daka King with Bras Thermography and Wellness. If you guys have any questions regarding the information that you see here, please give me a call at the information listed or shoot me a quick email. I'm going to first start with our medical disclaimer. The information provided is not a substitute for medical care or advice. Information provided is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Please consult your medical doctor about making any changes that are right for you. So our mission at Bras Thermography and Wellness is to empower women to take charge of their own basic preventative breast health and health restoration. Our motto is prevention, protection, and peace of mind. So what is thermography? Thermography essentially is a safe and early screening and monitoring of one's body with thermal imaging, or what we call DITI, which stands for Digital Infrared Thermal Imaging. And this allows you to visualize changes in your breast and body that is indicative of any dysfunction. And this works for men, for women, for children, regardless of age. The main question that I always get asked is, what is the difference? You know, everybody's heard of mammography. Well, what the heck is thermography? And so let's start there. So a mammogram is a structural test, right? It's a form of X-ray. They use X-ray to see the image, to be able to produce the images. So it's just looking for what's already there. It's looking for the bone, for the tumor, for the mass, whatever it's there, and the location and the size of it, okay? To do a mammogram, you have to compress the breast. It's typically about 50 pounds plate that they use to do that, and it can be very painful for some women. I know it was definitely painful for me. According to the American Cancer Society, the #1 cause of cancer in breast is radiation. And mammography has an 80% sensitivity and a 60% sensitivity, 80% for women over the age of 50 and 60 for those that are younger, which means that it misses about 20 to 40% of cancers. Large, dense, and fibrocystic breasts cause reading difficulties, and I'll show you why. So if you see my cursor, if you can, I'm not sure if it shows or not, the image on the right, far right, it's is what we consider very dense. When you're young, you have very dense tissue. A lot of women have dense tissue, which makes it very difficult for you to see a pea-sized mass or tumor, anything that's in there, because it all looks white. So it's really, really difficult. So that's very dense. The second image, it's more dense than fat, but it's still dense, still kind of hard for you to see if there's anything happening in there. You can easily miss a tumor unless it's in the fattier area. The third image from the right is, of course, more fattier than dense, and that's better. You might get a benefit from mammography if your breasts are in that stage. And then, of course, the one on the left is fattier. And this is one of the reasons why the recommendations for mammography has been moved to ladies over 55 or 50, I believe. And that is because at that point, you have a hormone change, and your tissue is you have more fat than you have dense tissue. So it would benefit you at that point. So early detection. This image circulates a lot through the internet, and I find it to be a little bit funny because it's so true. That's pretty much how I felt when I had my first one. But mammography is a reactive screening because it's looking for what is already there. And we react to it with surgery, radiation, or chemotherapy. That is just how our doctors react to it. Typically, by the time you have found a lump or tumor on the breast, it has been developing for maybe over 5 years, sometimes even 10. And the culture has been, we get cancer, then we treat it. So why not try something else? Thermography, on the other hand, is a test of physiology. It's looking at how your body is functioning. We're not looking for a structure, we're looking for function. And like I said earlier, it uses infrared thermal imaging or sensors to detect heat and increase vascularity. So the way a tumor grows, it has to be it has to be fed with blood vessels. So that increased vascularity lets us know that there's a tumor that is growing and maybe malignant, or it could be benign, but there's something growing there at that point if we know there's some sort of vascularity feeding it. So thermography, there's no compression, there's no pain, and there's no touch. The machine never touches you. And it is the earliest method of detection. And also the average sensitivity, it's 90%. I've seen research that says 96%, but that's just depending on what research you look at. And there's and so this is great for all ages. It doesn't matter if you're young, if you're old, if you're a child, if you're male or female. It's just for all groups, the sensitivity is the same. So a positive infrared image represents the highest known risk factor for the existence of or future development of breast cancer, 10 times more significant than any family history. And is independent of breast tissue. So like we showed you earlier, the 4 different breast tissues on the mammograms that had different densities. It doesn't matter with thermography. Thermography is not impeded by the density of your breast. And it can provide the first signal that a problem is actually developing. Here are some images of breast thermography. The one on the top left is a normal breast, what we consider, because we're looking for symmetrical things. So what's on the left is on the right, and so on. The one in the middle, you clearly can see that the left breast is much hotter. There's a certain pattern, and that is fibrocystic. That's somebody with a lot of fibrocystic issues. And that's something that we work with women. If you come in and you have fibrocystic or any cystic type of issue, there are recommendations that we will do. And plus, we also offer breast health prevention education with every thermography screening when you do come and get screened. So you just don't get screened and walk away. We screen you, we look at the images, we sit down and we talk to you about things that you can do proactively. And then the image on the right is DCIS, which is a cancer. And once again, it looks different than the other two, but definitely not symmetrical. Okay. So this is a chart to show the progression of cancer. So cancer cell, the average growth is about 90 days. And so if you notice, in 90 days, thermography can show warning signs at that stage, which is precancerous, right? And if you look at the 8, that's how big or how much buildup of that one cell into 4 billion cells has to occur before we can actually see it structurally, or in other words, under mammography. So that's a lot of years where if you know something is happening at an early stage, you have plenty of time to implement something natural, depending on how aggressive that cancer is. So some advantages of thermography. It can screen your entire breast regardless of size. We have ladies that come in that have very large breasts and they have a really difficult time with mammography. Thermography will screen your breast regardless of how large your breasts are, how small your breasts are. It can detect inflammatory breast cancer. Once again, inflammatory breast cancer is not going to have a lump because it's inflammation. And so mammography will not pick it up, but thermography will pick it up. And inflammatory breast cancer, IBC, is one of the most aggressive cancers. It goes very quickly. And when you come in, we talk about some of the signs that you need to look for in order to be aware of inflammatory breast cancer. Thermography also detects changes in breast tissue that accompany the smallest tumors. Like I said earlier, there's no compression of the breast. There's no radiation exposure. It's safe, it's easy, it's pain-free. It differentiates between dense tissue, fibrocystic breast, or any tumor, so it's independent of tissue. Effectively and safely screens breast with implants. So if you have an implant you're worried about, you're squishing with mammograms, thermography is perfectly safe for implants because we're not squishing anything. It is useful for the evaluation of chest wall after breast surgery. A lot of people who have had a mastectomy think because they had a mastectomy and they have no breast that they're out of danger. And it is really important that you monitor the pectoralis muscle because you don't know if there's any cancer cells that were left over. And like we showed earlier, it can take 5-8 years for that cell to turn into something. So this is just a really great preventative screening that you can do for yourself just for peace of mind. Thermography can also it's effective for breasts of all sizes, like we said earlier, and it creates an opportunity for early intervention. So we're not looking for, this is a great test for prevention. So we want to use it that way. Okay, and then all reports are interpreted by a medical doctor. So the biggest question for me is, if I know that there's a test out there that can let me know how my breast is working before it becomes a structural matter, I think I prefer that test. I don't know about you, but I want to know if something is not working right, what can I do to get it to a point where it's functioning properly before it becomes a mass or structure. Okay, so we are one of the few countries in which mammography is the gold standard. There's a lot of countries that don't even use it because it's so dangerous. So on average, there are 800,000 unnecessary biopsies performed a year. So statistically, in this country, 80% of biopsies are benign, usually fibrocystic, meaning that there's nothing wrong with the individual. They just did a mammogram, there was something there, they went in to look for it, they took it out, and then there was nothing. Why do that when you can do thermography and know whether it's fibrocystic, it's dense, or it's actually something that you need to be concerned about? If this is the case, why wouldn't you get a test done that will let you know years in advance so that you can be proactive and do things to keep it from becoming a structural issue? So cancer is the only disease in this country that we do not look at proactively. We do screenings for high blood pressure, for diabetes, things like that. But we don't do it for breast cancers. Why is that? Why not use a test that will provide you with the opportunity to be proactive? I hope the information that you found here was helpful. Like I said, if you have any questions regarding anything that you have seen on these slides, please give me a call or please shoot me an email and I'll do my best to get back to you as soon as possible. This is Deka King with Thermography and Wellness. Thank you.